Hello, I'm Dr. Sarah Wanza, Chief Dentist, Versatile Dental Solutions, practicing here in Nairobi, Kenya. Now, today I want to talk about 10 or more pointers, oral hygiene practices that you need to know. 1, why are you brushing teeth? Why do we have to floss? We do that to remove what we call dental plaque. Now, dental plaque is a film of saliva, food debris, and bacteria, both good and bad bacteria, a film that attaches onto your teeth, subsequently can cause tooth decay, gum disease. So that is why you brush your teeth. Now, how often do you need to brush your teeth? Now, brushing, timing. You need to brush your teeth twice a day, in the morning, in the evening. I always say in the evening, you're doing it for you, for your teeth, and for your oral health. In the morning, you're doing it for friends. You don't want to scare them away. You need to brush your teeth for 2 minutes. Now, the question of do I do it before or after breakfast? Now, you should never brush your teeth immediately after a meal. Always give yourself about 45 minutes because when you brush immediately after a meal, there's so much acidity in your mouth, you're gonna end up corroding your own teeth. Now, teeth brushing, there's a technique. How do you brush with a manual toothbrush? How do you do it with an electric toothbrush? Now, the technique, let me demonstrate that real quick. Now, it's electric, but we're gonna assume it's a manual toothbrush. Mouth open. You want your bristles, these ones, you want them at a 45-degree angle to the junction between the tooth and the gum. And from there, you're going to do small circular motions. So toothbrushing technique with a manual toothbrush, bristles at this junction between your tooth and the gum. See there? That's where you want them to hit 45 degrees angle and then do small circular motions. Small overlapping circular motions on all the surfaces of the teeth. Huku nje, then do the inside, and then on the biting surfaces, this is allowed. Now, for most people, wisdom teeth don't develop normally, so you may want to angulate your brush towards the wisdom tooth so that you can clean it adequately. On the upper teeth, the farthest tooth, close your mouth a bit and then clean like that. All right. Now, electric toothbrush, bristles, 45 degrees angle to the junction between the tooth and the gum. Put it on, apply some pressure and move it along. Move it along without a lot of actions. Now, okay. One thing you should never do with your teeth, this. This causes you more trouble than it helps. We're going to talk about the trouble much later. So like even on this model, you can see what this is trying to show is gums that have pulled away from the tooth, mainly because of such. Now, when this happens, when you get gum recession is followed by what we call abrasion lesions, whereby it's like the more you do this, the more your tooth wears out at the neck. When you brush your teeth, you take care of about 65% of your teeth surfaces. 35% is in between the teeth. Remember, you've not touched that. So you need a way of cleaning in between your teeth. Flossing. You should floss once a day. There's use of the traditional floss. Now, when you're using the traditional floss, there's a technique to it. You don't want to go right just in and hurt your gum. You get your floss, you go in, hug onto a tooth, bypass the gum, and then come up. I promise you, you will not be hurting yourself. I wish I could demonstrate that. We're going to attach something demonstrating how to floss effectively. Now, with current advances in the market, we have water flossers. Water flossers come in handy, especially for people with braces, people with bridges, if you have implants, and if you have gum disease. But either way, water flossers can be used by anyone, only that don't let the water flossers replace the traditional string floss. They should complement each other. Another mode of cleaning in between your teeth, interdental brushes. Now, interdental brushes come in different sizes. but I am of the opinion that you should not force an interdental brush between your teeth. If there's like no gap between your teeth, don't force it. Use the string is adequate. But if you do have spaces in between your teeth, you can use the interdental brushes. Now, interdental brushes come in very handy for people with braces. They can go under the wire, beside the brackets. And if you do have, like, let's say a bridge, and there's some space between your bridge and the gum, interdental brushes help a lot. So there's that. Water flossers. This is an example of them. Now, what a water flosser does, it has like a water tank. You put water in. Sometimes you can put water with a bit of mouthwash, and then the gadget has a whole operation. We'll get into that at some other date. So water comes out of this nozzle under high pressure. Now you direct that to your teeth, to in between your teeth, and that is what dislodges any dental plaque that could be stuck along your gum line and in between the teeth. Remember, water flossers don't replace traditional string floss. They work together, make them a team. Tongue scraping. You should always scrape your tongue after brushing. Now, from personal experience, trying to clean your tongue with your brush is not adequate. Sometimes, yes, you'll clean, dislodge part of the dental plaque, but you're going to have some left there. What a tongue scraper does, a tongue scraper sort of scrapes it out. Vizuri, you can even see it and just clean out your sink. So a tongue scraper cleans your tongue. Now, a number of cases of bad breath can actually be solved by just tongue scraping, including flossing and tongue scraping. Very, very important. I'll show an action of the use of the tongue scraper also much later. And then I want to talk about the choice of your toothbrush. Now, when you're choosing your toothbrush, you want something that will not hurt your gums, and at the same time, it will actually get the dental plaque out. Remember, ile uchafu, the film of food debris, saliva, bacteria, you want a brush that can get that out. So anytime I'm describing a toothbrush that I'm recommending, I like to say that get one that is soft but firm. Okay, soft but firm. You don't want a very soft brush because that will sort of just paint over the dirt. You want something that can actually remove but not hurt you. I'm in the hunt for the perfect toothbrush. I'm gonna come back with that information. So choose the right toothbrush for you. Now for children, same thing, soft but with firm bristles. Now toothpastes. Please make sure you're using a fluoridated toothpaste. Highly recommended. Now, there's so much controversy in the market about fluoride-free toothpastes. Now, fluoride is not bad. I know that we have so many stories of fluoride causing dental fluorosis. Now, fluoride is not bad. Topical fluoride, it is fluoride on top of your teeth. That is fluoride that helps you fight cavities. Now, fluoride in the system, systemic fluoride through like borehole water, that is dangerous for children if it is in excess. That will cause both dental and skeletal fluorosis. So please, mwache controversies. So use fluoridated toothpastes. It's good for your teeth. For your children, make sure they are not swallowing the toothpaste. Get your cleaning done at the dentist twice a year. Now, cleaning for a child is different from cleaning for an adult. And cleaning for two different adults can also be different because let's say this one has quite a bit of gum recession, a bit of periodontitis, gum disease. He or she will get cleaning under local anesthesia. Like some areas of the mouth will be numbed so that they can be cleaned adequately. Another adult will get cleaning without any numbing necessary. So cleaning varies from one person to another. But either way, highly recommended twice a year. Let's circle back to toothpaste and children and fluoride. Now, give your child fluoridated toothpaste. Now, make sure you're giving them the toothpaste for their designated ages. We have toothpaste for children under the age of 2 and between 3 to 5, and then we have another one between 6 to 8. That designation is about the level of fluoride in the toothpaste. So give the child the designated toothpaste. Also, for children under the age of 3, you need to give only a smear in the amount, just a smear, kidogo. For children over the age of 3, a pea-sized amount is recommended, like a grain of rice amount of toothpaste. Don't give them much. Now, dental fluorosis affects children below the age of 8 when the teeth are developing. So you want to make sure that your child is not swallowing toothpaste at that age. You also want to make sure that you're not using borehole water in the house, especially for cooking and drinking. You also need to make sure that give them the designated. If a child is below 2, if you give them like the adult toothpaste, it has way more fluoride, so you don't want to do that. But fluoride is good for your teeth. That's all I'm trying to say. It's good for your teeth topically. That is why we do have fluoride treatment in the dental office to fight tooth decay. Still on cleaning, if you do have braces, there's what we call a braces care kit. Please make sure you have it. The braces care kit will have both floss and threaders for you to be able to direct the floss enough to floss in between your teeth. Part of the braces care kit, buy yourself a water flosser when you have braces, because no amount of brushing can take care of all the dental plaque that will be trapped under your wires, under your power chains. You do need a water flosser. The braces care kit generally just contains brushes, a mirror, a timer, dental floss and threaders, and dental wax for when you need some relief from maybe an impinging wire. Yeah, so those were my pointers on oral hygiene practices. Now, the best way to make sure you maintain your practice, make it a routine. Like, you see that bedtime routine that you have, let it include brushing, flossing, tongue scraping. Let me tell you, the moment you make it a routine, not just for yourself, but for your child, it will be so easy to maintain. But let no one lie to you. These things are not easy to do for anyone. These things are repetitive, they get boring, they're not easy to do for anyone. So the best way you can keep them going, maybe make them fun, make it a family activity. Variety, you can have both a manual toothbrush and an electric toothbrush. Get to choose. If for your child, you can give them different colors, let them choose. Make it fun and make it a routine, a kind of a routine that you respect enough to keep going. So oral hygiene is at the top when it comes to preventing most of what we deal with on a daily basis: tooth decay, gum disease, and bad breath. So you do want to make sure that your oral hygiene routine is top tier and it is inserted in your kawaida routine, making it easy. Yeah, so that is it for the pointers on oral hygiene. Most of these have come in small points. Definitely we'll get more into them, their benefits and the differences. But for now, I hope you learned something. Yeah, see you in the next video.